So we did just get asked, are we being asked to avoid the school questions? I do tend to avoid asking you guys the school questions. So that's me. That's not anybody asking. We're here to talk about what we're doing at Mary Washington Healthcare, not necessarily what somebody else is doing. So maybe Dr. McDermott, if you could address that I am avoiding asking all of the school questions, because I'd say 75% of the questions coming through today are school
I'm
questions.
going to share my opinion, and because it's real and it's how I feel, and it's not much different from everything else that I've said today when I'm imploring everybody to stay in your household units and limit the amount of time that you're around others. And I'll just say, when you're in a situation with prevalence being as high as it is now in our community, throughout the state, throughout the nation, right? And when you see the pressure on the healthcare system and hospitalizations that you're seeing, not just here locally, but throughout the state and throughout the nation, I don't know how you look at an environment like going back to in-person school at this point in time responsibly. I don't know how you do that. And that's my opinion on it. And I say that because, looking at the situation that we have and following the actual facts in the course, in the prevalence, and our hospitalizations and everything else that's going on right now, it's never been a worse time, right? And if schools were considering not going back in the fall when the prevalence was much less, how do you do it right now when the prevalence is higher than it's ever been, and the number of patients hospitalized is higher than it's ever been, and the number of patients dying from COVID every day in our country is higher than it's ever been?